Ramsdell. I am a pediatrician in Apex, North Carolina, and my practice is Ramsdell Pediatrics. I went to the University of Toledo and I did my undergraduate there. I got a degree in arts and sciences, including biology, and then went on to the University of Cincinnati for my medical degree. Decided I wanted it a little bit warmer, so came down to North Carolina and did an initial combined internal medicine pediatrics program for the first year, and then went strictly with pediatrics thereafter. So I have two great kids. They're phenomenal, totally different personalities, which makes it a great mix. My daughter is 15 and the epitome of a true teenager in many ways. My son is almost 11 and he's the epitome of a boy. So I think I have a great mix of kids. They keep me on my toes. They keep me playing Nerf guns. They keep me going to Justin Bieber concerts. Yeah, they're a good group. I get to go to flag football games and things like that when I have time. If I don't have time, then I miss those things. And so they're life. They're my life. And I would not be as good of a pediatrician if I didn't have children to teach me things. My parents that I have in my practice know my kids. I tell them stories, and I'm able to actually teach the parents some things when I've had to go through it myself. So in a way, my children are very, very helpful for my practice because they make me a better pediatrician, and then I can make those parents better parents. I am from Toledo, Ohio, born and raised there, and decided I wanted to be in medicine because I really enjoy helping people. Even as a small child, I played doctor and was trying to diagnose kids and concoct medicines to see, if they would really be helpful. So I've always been dabbling in something. And I thought, what a great thing to do as an adult. And so it took off from there. I chose pediatrics specifically because I really enjoy getting on the ground with the kids and interacting and being silly, and they don't really ask to be sick. They just want to feel better, and I find that that's where I thrive the most, is helping people who can't help themselves. I started out in medicine in 1999 and had gone to a multitude of areas in North Carolina and Virginia. And I chose this initially because my parents were super close by and I wanted to be close to them, but I also wanted some autonomy. I've done it everybody else's way and I didn't like it. And I found that the only way I could make it work for me was to go on my own. And this community is a phenomenal community with a multitude of different people. When I was visiting my parents, I'd go back and forth on I-40 from Charlotte or from Lynchburg, Virginia, and every time I drove by the Apex outlet or the off-ramp for Apex, I'd get a chill. And I was so fascinated by that feeling every time I'd go by. I just knew I had to check it out. And I knew I was going to go into pediatrics. I knew I was going to go into my own practice. I just didn't know where. And when I saw the sign for Apex, it literally drew me to it. And I started researching it, and I liked the community, I liked the neighborhood, I liked the feeling of community, family, and I knew this was home. I've been a little bit everywhere, but it was always working for somebody else. And I really just didn't enjoy being stuck in medicine that way. I was always pushed to see more patients, work harder, and not perform the way I wanted to, not really getting to know those families. And I knew that that's not the way I could continue being a doctor. It just wasn't the right way to do medicine. Medicine was actually fun. It was, as a new office, I was able to really get to know those first few patients really well. I knew their families' names, I knew where they lived, I knew what the dad did for work. I knew what the mom did. I knew where the kids went to school. And I had the opportunity to really get to know the whole family, which is very helpful in medicine, because medicine is just not about amoxicillin. It's more of the whole body. And you've got emotional support, you've got spiritual support. You just can't do medicine based on a prescription. And so in those first few years, it was so much fun getting to know families and being able to spend time with them in a growing community. So I got to grow along with those kids. As time has gone by, it's become so busy because I have to keep up. And I have very little time to know my patients before I shuffle them through the door. That's been really frustrating for me. I find that I don't always get to know the patients the way I wanted to know them. I don't get to know their nuances and the fun things about kids. I don't get to play with them as much as I used to. And I feel like I'm rushing them out the door so that the next person can come in. And that's not the way I ever wanted to practice medicine. It's not what makes me tick, and it's not the best thing for my patients. I find now with the healthcare reimbursement, it's markedly decreased, and that seems to drive most doctors to want to see more patients in order to meet that bottom line. I can't do that. That's not how I work the best, and that's not how I give the best care for my patients. So it's been frustrating as these years have gone on to feel like I'm getting lost in this big conundrum of healthcare. And the last thing I want to do is be absorbed by one of those big companies and lose my autonomy. I think the challenges that all physicians face in this healthcare industry is the fear of extinction and the fear that we will not be able to practice medicine in the best interest of the patient. Many times we are forced to get prior authorizations or forced to choose a different antibiotic because of what an insurance company dictates. It's not based on what we feel is best for the patient, and that's extremely frustrating. When we're not able to provide health care the way we want to provide it, it's providing a disservice for our patients, and it's very frustrating for us. I think that when somebody else dictates how you do your job, they're not putting the patient first. And that sets up a huge precedent for failure and illness in this country. So I think that that's the biggest thing, is we're losing our ability to make decisions for our patients in their best interest. As far as what healthcare has done for me in this environment, I find that being a solo pediatrician is very difficult, because as healthcare reimbursements decrease, I'm not able to meet the bottom line. And many doctors would just throw in the towel and either not practice medicine anymore or be absorbed into something bigger. But that's not how I practice the best. I've found that in order to make ends meet, I work harder, I work longer hours, I work on days that I'm not supposed to work, I take my phone with me, and sometimes I miss things with my kids. And that hurts me, and especially hurts my children. And as they get older, the last thing I want is to miss something big and have to blame my career for that. I love what I do, and I don't want to give that up. I just know that there's a better way to do medicine. Concierge medicine is a way to receive health care that benefits the patient in a phenomenal way. They have the access to many things that a typical patient wouldn't have at a big, huge practice that we see today. For my patients, what that means is the ability to contact me anytime, day or night, weekend, holiday, when I'm on vacation, and be able to talk to me, get me on the phone. They also have the ability to text me if they want, or to send me a picture, or FaceTime, or Skype, all these wonderful electronic ways of contacting someone. So I think that that is a true benefit, especially for parents who have young children or children that are sick and they just want to run something by me. It also means that they don't have to wait forever to get an appointment. Instead of waiting 6 weeks to get your child's next checkup, they can call me the next day, and there's their checkup. If they want multiple kids seen at one time, guess what? They can do that instead of having to separate children because there's not an appointment slot available. If their child's sick at night and they want to run something by me, if I think that they need to be seen, I'm going to get to see them. They don't have to go to an urgent care. They don't have to go to an emergency room. They get to see me. And if a baby's born and mom's too sick to come out, guess what? I'm going to go to them and make sure that that baby's well taken care of, so that mom doesn't have to bring her or him out to the doctor's office when they're only 3 days old. So it's the accessibility, I think, that's really going to be helpful for so many people and their kids. I think it's going to take medicine back the way it's supposed to be and put it back in the family's hands. I decided to make this change because it's the best care for kids. There's nothing better than having a child come in and have fun in a doctor's office and get to really know the staff, and vice versa. If you have a lot of time on your hands to really get to know a family, you get to know a lot about the health of not just the child, but the family. And there's so many different things that in a regular doctor's office you can't pick up on. Postpartum depression in a mom. How many times have I seen it? A lot. But I could pick out more, I think, if I had more time. So for me, I decided to make the change to concierge medicine because I knew it was the best way to provide medicine for my patients. I knew that having that ability to take time and spend it with kids and get to know them and get to know their families, it gives me an opportunity to do more than just prescribe an antibiotic or to push them through the door. It gives me an opportunity to learn more about their development, to learn more about their psychological state, to learn more about their academic struggles or their social struggles at school. It gives me an opportunity to really formulate plans for nutrition, for exercise, for alternative medicine, which I don't have the ability to do now. So it's going to give patients more accessibility, more freedom, and more confidence, especially their parents. I think it's a perfect choice. I think concierge medicine is going to be a phenomenal thing, not only for my patients. Being able to spend more time with them will allow me to learn more about a diagnosis and give me more opportunity to research different options for treatment. But it also gives me time for myself and also more time with my kids. So not only will I be able to focus on some of those things, but it'll make me a better doctor. There are things that I haven't even been able to focus on lately, which is community service. And I've wanted to go out for a long time and be able to have the time to discuss different options for patients, give lectures, get out there and volunteer in some of the underserved areas. I just haven't had the opportunity to do that. I know that concierge will allow me to do that, and it'll make a difference. There's no better way to have medicine provided for you than concierge. You can avoid going to an urgent care and getting misdiagnosed by somebody who doesn't know your child. You can be kept out of the emergency room with multiple procedures, misdiagnoses, spend hours being exposed to other children who are sick in the emergency room when this could have been handled either at your home or in the office in 20 minutes. You have the peace of mind to know that your doctor is a phone call away and you don't have to worry about going out in the middle of the night and being worried about your child. I think that that's one of the best benefits that concierge medicine, specifically pediatric concierge medicine, will provide for any patient and any parent who has a little one.